Sarah, tell me about a patient who came in thinking she needed one thing to tighten her body and eliminate cellulite, and you saw that she could actually benefit from maybe stacking treatments to get the best results. What was her story like?
So, most women have more than one thing going on. And let's just describe a particular patient I'm thinking of. She's been on a weight loss journey. She had lost about 20 pounds. So, not severe weight loss, but enough that she's seeing changes to her skin, right? Even though she lost that weight, that stubborn cellulite remained, and definitely was the reason that she came in. So I see this a lot. Women typically describe everything they don't like about their butt and thighs as cellulite. And it's my job to educate them on what is cellulite, what might be loose skin. Do we have some volume loss going on? Maybe a little volume excess. It's typically a combination of all of those. So for her, she did have true cellulite, which we treated with Ovally, in any other form or fashion. I see a lot of skin laxity. So that's where it is important to find a provider that's experienced, that knows the difference, is going to explain to you, what treats what.
Sarah Viebrock is a cosmetic nurse injector and national trainer at Austin plastic surgeon Dr. Johnny Franco's practice, where she's known for building each patient's body sculpting plan from scratch instead of performing the same procedure on everyone. Welcome back to Beauty Seek. Sarah,
Thanks so much for having me. If we're trying to do non-surgical skin stacking, it's going to include a treatment plan of devices maybe like SoftWave, maybe Aveva, maybe some injectable skin fertilizers or biostimulants, like I like to call them, aka something like Sculptra. And that's what we did for her. We built this custom treatment plan, combined cellulite treatment with skin tightening, and she got an awesome outcome.
great. Oh my gosh. And I can't wait to dig into this, but it makes it so evident that we as beauty seekers should be coming to someone like you who have had the years, and run the cycles of, gosh, how to put together an appropriate plan.
Absolutely. It is so important for many reasons. One, safety. You've got to make sure that you're not treating every little waviness to the skin as cellulite, because as we discussed before, if you over release, you can actually create problems.
Help us understand how you might evaluate and build different types of body sculpting plans that might stack treatments based on the many different types of bodies that you see each day. Let's walk through some real patients. A woman who her only complaint is dimples, no loose skin, no volume, just cellulite. On a scale of 1 to 10, how likely is it that just releasing the cellulite bands and nothing else would give her the results she came in for?
Honestly, high, 8 to 10. I mean, if she's got realistic expectations, then hopefully a 10 out of 10. That's always kind of, what it comes down to. But if she truly, her complaint is cellulite, and on evaluation, that's what I see as well. Maybe she's young, she's not lost weight, she's still got healthy skin. She just has some of that traditional cellulite caused by those fibrous bands creating those indentions. Then a procedure like Ovally, where we release her bands, is going to give her a great outcome. And she is an ideal patient for that.
Perfect. Very simple. Let's not overthink it, right?
Right. Right. Yeah.
Okay.
Send me that all day. Perfect.
Okay. Perfect. Love that.
If we only released her bands, chances of her being happy is probably less than 50%, right? Because we're really treating less than 50% of the problem. So, again, this is where the education comes in. We only released those deep dimples. I'm only treating those bands that do not improve when you kind of pull up on the skin. Now, say she's lost weight, she's got loose, wavy skin. That means, sure, some of the deeper dimples will remain, but when you're doing a treatment to your butt and thighs, you're never going to stare at your butt and thighs more. And so all she's going to see is that waviness that remains from that loose skin.
What would you do to treat the waviness, the loose skin?
That's where it kind of depends on who you're coming to see. So say you're coming to Austin Plastic Surgeon, we're looking for a non-surgical solution for skin tightening. And actually, this is probably these days 80 to 90% of my ovule cases, I'm combining with something for skin tightening because most of us have lost weight, been on a GLP-1, or are just naturally aging, right?
Yeah.
So that is the big majority of my patients. And we have a couple different ways that we do that. So if we're looking for non-surgical skin tightening, I am going to likely start with a device like maybe SoftWave. SoftWave is ultrasound-based skin tightening. Another one of my favorites is something called Aveva. Aveva is a laser that does skin tightening and skin resurfacing using the Martini effect. If you haven't heard of that one, look it up. One of my new favorites for sure. And then say maybe she's got a little more laxity than minimal, right? Maybe we're getting to moderate and I need to stack something. We came up with a term called skin stacking or a collagen combo where I'm going to layer that device treatment like we just talked about. Another one that I love is called Quantum RF. So those are my top three, I would say. Now we're going to layer that device with, and we're doing the sandwich technique now, with a biostimulant. So not necessarily for volume. We're just talking about rebuilding your collagen and elastin. So one of my favorites is Sculptra or PLLA. Another option is Hyperdilute Radiesse or CAHA. Those are some terms that you might hear of. And we're literally stacking or sandwiching these two modalities to wake that skin up and force it to make fresh collagen and elastin. That's the only way that we're going to get skin tightening is by rebuilding your collagen and elastin. So it's not instant. And that's where the education comes in. I've got to set that expectation that these results are going to take 6 to 12 weeks for you to see, but you're going to be really happy that you treated that waviness in addition to those deep dimples if you're looking for an overall smooth appearance.
Okay. So ultrasound can tighten the skin. Drinking martinis can tighten the skin. I'm just teasing.
I know, right? Aveva's exciting. You got to look it up. It's a pretty cool technology. They focus the laser in this martini glass shape, but the martini effect, it's cool.
I love it. Okay, I'm going to dig into that. But the rest of what you were talking about are actually injections. So your skin kind of heals itself.
Right.
That's what I'm.
Right. Yeah, exactly. And that's how I describe these skin tightening devices as well. We're basically creating a controlled injury to the tissue. You know, we stop making collagen in our 20s, right? So if we don't do something to wake up the skin and force it to heal itself and make fresh collagen, then we will have no fresh collagen, right? So we're doing that by, creating this kind of controlled injury to the tissue, whether we're using a device, an injectable biostimulant, wake up those cells that make collagen again so that we can get that youthful appearance back to our skin.
Wow. In our 20s. You stopped me at 20s. We're okay.
I know. Every year it declines.
Oh my goodness. Yes, I asked, one of the surgeons that I interviewed the other day about collagen. I said, what about collagen supplements? And she's like, well, you can if you want.
That's what I say. I'm like, it's not going to hurt anything.
Yeah.
Not
Great.
likely going to tighten it, but it's definitely not going to hurt anything.
Okay. That makes sense here. Okay. Here's another. A woman with dimples, but also hip dips where the sides of her buttocks are, I don't know if this is the right word, like kind of caved in. How much of her result is really about smoothing the cellulite?
Yeah, I mean, so say her two main concerns are cellulite and hip dips. I mean, if we only treated the cellulite, she's going to be maybe 50% happy, right? That we're only treating half of the problem. If she really wants to improve that hourglass shape or the overall shape of her booty. Now, I will say, and we haven't even touched on this yet, which is an exciting part. If you release the fibrous bands that are actually flattening the butt, you can see an improvement to the roundness of the booty when we're talking projection from the side. Now, it's not a BBL, it's nothing crazy, but it actually can affect the shape. But it's very rare that we have cellulite that we're releasing in those hip dips. So in that case, we typically need to replace some volume. And one of my favorite ways to do that is with aloe clay. This is an injectable processed donor fat that can be done technically at the same time as your ovule, typically, depending on the patient, so that we're releasing those fibrous bands and then adding volume to those hip dips to give you a smooth booty, but also that hourglass shape that you've always wanted.
Okay. So you're injecting fat into the hip dips.
Yep, exactly.
And we talked about aloclay. And is that if someone doesn't have their own I've heard of getting fat from your belly and putting that in your booty. But if they've just lost a ton of weight, they don't have fat. Is that correct?
Right. So that is one of the most common patients that's using clay is someone who's maybe lost a lot of weight, doesn't have fat to transfer. But another common patient that we see using clay is just someone who doesn't want to have surgery or doesn't want the downtime. With traditional fat transfer, you actually have to stay off your butt and hip dips for 6 weeks. With clay, we let our patients sit right away. That fat is already processed and stabilized. So for patients who don't want to deal with anesthesia, they want to be able to get back to work the very next day. They want extremely minimal downtime, but also a nice outcome. Then it's a really great option for them. Now, I want to be really clear though, clay is typically not replacing a BBL. I'm never telling patients, hey, you're going to come in here for an awake procedure and leave with a Kim K booty, right? That would take a ton of volume. So I'm really big on setting realistic expectations, but that patient you were describing that's got cellulite and hip dips that she doesn't like, this is perfect for that.
Wow, that's amazing. And can you go over again why can they leave and just sit on their booty with aloclay versus, alternatives?
Yeah. So say we were doing a traditional fat transfer, which of course that would be with one of our plastic surgeons, where they're doing liposuction from an area of the body and then immediately transferring that fat to your butt or hips. In that case, that fat has not been processed and stabilized and gone through this rigorous process that Tiger Aesthetics does for Alloclay, which makes it shelf stable. It's not relying on your body to keep it alive or to help it remain, right? If I'm taking, and again, it wouldn't be me. If our plastic surgeons are taking fat out of your abdomen and putting it in your butt and thighs, that is relying on blood supply. It's got to be maintained by your body. And it's also got a lot of liquid and, volume that will be absorbed. So we've got to treat it like a baby. We try to stay off of it as much as possible for the first 6 weeks. So that can be a really gorgeous result because you are liposculpting, you're getting that subtraction of the waist and love handles and then adding to the booty and hips. But not everyone wants that downtime. So sometimes if you're looking for a really minimal downtime procedure, then this might be a better option.
Yeah, that sounds like a great option. What about longevity with the aloclay versus the traditional fat transfer?
Great question, hitting me with the hard one, Sam. So, I know we discussed this with Ovally, and when it comes to longevity, the answer is the same. I have to give you kind of the correct answer. We can only tell you that it lasts as long as the product has been out and been studied. We at Austin Plastic Surgeon were lucky to be a part of one of the initial clinical studies for the product. And we have patients almost 2 years out that we are following longevity. And we actually are seeing between 80 and 90% retention. And what we've seen over time is once their swelling goes down, which is pretty quick, between 2 and 4 weeks, depending on if they ended up with any bruising, maybe, we actually see that result stay pretty stable from that point. It's not diminishing. It's not going down over time. And we also are seeing, if you are comparing a before and after from maybe their 2 to 4 week point, especially definitely from their 6 week point to their 2 year point, we're seeing basically the same outcome. So again, you can kind of take what you get from that. I can't promise that anything is permanent, of course, but we're seeing really good long lasting results from this product. It's very, very exciting.
I love that. And honestly, it's comforting to hear you say, hey, we may not know, there's some unknowns versus
Right.
everything is,
Oh, yeah. Yeah.
Mhm.
And you got to be transparent. You got to be clear. So this is the info we have so far. And I was interested to see how the patients would be excited for Alloclay, if they would be hesitant. We can't keep it on the shelf. We have patients flying from all over the country for it, or excuse me, all over the world even. So, it's a really, really exciting product. And typically it's, a patient that's been searching for a specific concern, right? And they finally found the specific solution for that concern. So it's amazing.
That's great. Wow. Austin Plastic Surgeon, you guys are way ahead. Way ahead.
Thanks to Dr. Franco. He stays at the cutting edge. I definitely have to give him the credit for that.
That's great. Great. Okay, you're in a like a growing learning environment. I love that. Oh,
Absolutely.
Okay, the opposite problem. A woman with maybe a banana roll, if that's the appropriate word,
Mhm.
under her
Yeah.
buttocks, or some fullness in her central body that she just can't stand. How much of fixing that is about adding volume? Would you ever add volume? I've heard that to kind of like, kind of even everything out.
Mhm. Yeah, yeah, good question. And I do hear, or excuse me, I do see that commonly where, obviously there's areas where we may want to add volume, like the hip dips, but there's also areas where we may want to take away volume, like the banana roll, or some people refer to that central booty area as a chicken butt, where it's like, and women that have it, they know exactly what I'm talking about because they will come in and describe it in that way. So I know these are kind of funny slang terms, but it's just areas of the butt and thighs where we've got fat accumulations that we cannot get rid of. So,
Mhm.
sure, adding to your hip dips is going to change the illusion of how your butt looks because we're creating this sweetheart shape, right? But typically it's about the addition and the subtraction. So, in an ideal world, we are removing a little bit of volume. One of my favorite ways to do that non-surgically is actually with some deeper RF microneedling. Some of the most common companies that do this are Morpheus, Vivace. That is a device that's used really commonly all across the country for skin tightening and collagen stimulation. But this is where you do, again, need to be really careful that you're going to an experienced provider. If they're doing RF microneedling too deep in your butt, you can actually lose fat. And that is typically not what we want. Now, in this case, though, we do because we're talking about the banana roll, right? For example, that's the easiest kind of area to imagine. So, in that case, that's the only area where I would be okay treating a little bit deeper with radio frequency microneedling and actually killing some of those fat cells so that over that healing time frame of about 6 to 12 weeks, your body will absorb those dead fat cells as waste and you will see that just kind of flatten out. It can take a couple treatments, right? It's not a magic wand. It's not liposuction. We're talking about a non-surgical solution, but I have created some really beautiful results by reducing a little volume that way, adding volume where we've lost some, and then smoothing that skin with maybe some cellulite and skin tightening, cellulite treatment and skin tightening.
Okay. Is there anything that you could do that would then counter the effects of that treatment? Like I was interviewing a plastic surgeon the other day, and the woman who was in charge of all of the non-surgical procedures would just, was very clear. Do not go out and work out after you have your facial. It will just counter the effects and you'll be wasting your money. Or here is it like, it really doesn't matter. You can, unless maybe eating a
Yeah,
donut.
yeah, I mean, right. You don't want to do something that's going to cause you to gain a ton of weight because then you won't be able to see any difference that we're making, right? But yeah, I mean, I as with anything, I'm going to have you avoid working out for a certain time period depending on which procedure we did, and that's just so that we're not increasing inflammation or, increasing risk of infection with sweat and stuff like that. But after a day or two, if we were just doing an RF microneedling procedure, you can get right back to anything. And it's not going to counter that effect at all.
Okay, last one, and it's everywhere right now. According to the American Society of Plastic Surgeons, body contouring procedures after major weight loss have surged with the rise of GLP-1 medications like Ozempic. So, a woman who's lost a lot of weight still has cellulite, but now also has loose skin and lost volume all at once. I'm just going to hand it over to you. How would you evaluate and what might your stacking procedures be?
Oh, yes, the dreaded Ozempic booty or Ozempic butt. This is what we see all the time. I mean, very, very commonly, we have a pretty high volume of weight loss patients in our practice. And if they're not losing weight with us, then they likely are getting those medications somewhere. We know they are everywhere right now. And if they have lost a substantial amount of weight, then they absolutely are going to see those changes in their butt and thighs. So this is where creating that custom treatment plan really comes in, to create a great outcome. So we've got to treat all of the different concerns with a different modality so that everything is being treated appropriately, right? We're going to treat her cellulite with Ovally. We're going to get rid of those fibrous bands because if I don't do that, if I just do everything else, she would still have those deep dimples, right? We're going to pair that with something to tighten the skin, maybe some of our skin stacking or structural sandwich procedures that we discussed earlier. We're going to replace lost volume with something like aloe clay. oftentimes I can do these together, or it might be a stage treatment that we need to do over a couple months up to a year, and maybe even financially, if you want to break these procedures up, we absolutely can do that too. Sometimes I'm building out a year-long treatment plan, just like we might do for your face, for your butt and thighs, right? So as long as we're addressing whatever concerns you have based on, say, this particular patient's lost weight, she's got cellulite, she's got, loose skin, she's got volume loss, and we're creating a treatment plan for each of those concerns, then she can get a really great outcome non-surgically. And it's super exciting. Now, I'll still say, because I work for some fantastic plastic surgeons, if they have lost a substantial amount of weight, that's where it is so great when you do work so closely with plastic surgeons, because sometimes, and I'll be the first to tell you, don't waste your money on non-surgical options if it's not going to give you the best outcome. Sometimes surgery is the best outcome. And that's where, again, making sure that you're going to a provider that can give you the right treatment plan so that you can get the best before and after that you can.
In what instance would you kind of make that suggestion to, gosh, I'm going to refer you to a surgeon?
It's hard to say, an exact amount, but if someone, because, depending on their frame, right? Like I actually lost 40 pounds on GLP-1 medications. But 40 pounds on me, I'm 5'6", looks a lot different than like someone that's shorter, or depending on how quickly they lost it, right?
Mhm.
Depending on the quality of their skin. So everyone is different. We really do have to evaluate them in person to know, hey, this is absolutely something that I can treat non-surgically, or would you be happy with this type of before and after? But if it's someone who their skin is literally kind of hanging over the top of their booty, they've got that like kind of crease from the skin hanging over, then we know there's someone who's probably going to need some type of butt lift or body lift. And that's where, I'm going to be the first to tell you, don't waste your money on something non-surgically. Or like, hey, maybe you have cellulite and we do need to treat it with Ovally before, Dr. Franco or one of our other surgeons does some fat transfer or a butt lift, right? So sometimes it's a combination of non-surgical and surgical outcomes, but that's where you just want to make sure that we are creating that custom treatment plan based on your specific body to get you the best outcome.
I love that. It makes sense just to pause, step back, because we all want it to happen so quickly, and we
Right.
might jump into a treatment. Yeah, that treatment might not have
Isn't the
been.
right one. Hmm.
Yeah. Oh my goodness. So, Sarah, you spent this whole conversation just taking the blame off women, and I love that. What is it that keeps you doing this, patient after patient?
It's all about the confidence. So, as we mentioned before, I love doing cellulite treatments because it affects all of us so deeply. It's something that, has probably driven us crazy for years. And if something is affecting your confidence, then it affects every part of your life. It's almost like losing weight. When you've lost weight and you've got this new confidence, then every part of your life shines, right? Like you feel better at work, you feel better in social situations. The same goes for doing cellulite treatments or really any aesthetic procedure where I'm improving something that bothers you. If you've got that newfound confidence, then you're going to be confident in every part of your life and just happier overall. So definitely it's my patients and the fact that they've got this new confidence that shines in every part of their life. So if we've, solved the problem that has driven you crazy for years, likely you're feeling fantastic. You're, at Pilates in your tight workout pants, maybe a light color, which you never felt confident wearing before, right? That confidence is going to soar. And that's the best part of my job.
Right. Yes. If I can wear pink leggings, that would be great.
Right? Yeah, exactly.
Okay, beauty seekers, here's what to remember. Now you can minimize the look of cellulite by releasing the septi bands that cause your dimples. It's very rare that there's a single treatment that fixes all of our body sculpting desires. To treat multiple body sculpting needs, you should visit a professional like Nurse Sarah to tighten loose skin, pull volume back where you've lost it, and or reduce where you don't want it. The smoothest, most sculpted results come from a plan built for you by a professional like a registered nurse like Sarah. Sarah, thank you. You showed us all that cellulite is never a woman's fault and that it can finally be treated. You are a gift to the Beauty Seek community.
Thank you so much, Sam. Thank you for having me. Thank you for helping raise awareness around this topic that means so much to me, but also I know affects, as we said, over 90% of women. So I could not be happier to be here.
Great. Yeah. And I would love to come back and talk about what was it? What was the topic that, oh, the martini.
I know the martini effect of Ava coming up next. That's one of my favorites. You can actually use it head to toe. So let's do it.
Okay, perfect. Great. Let's do it. Beauty seekers, if you want honest, evidence based answers about treatments like cellulite, straight from experts like National Cellulite trainer Sarah Viebrock at Austin Plastic Surgeon, subscribe to Beauty Seek so you never book a treatment blind again.